Do you remember this? Pictures of teenagers in the hospital hooked up to ventilators and doctors warning that vaping caused something called popcorn lungs. The CDC started investigating in 2019. Then the pandemic happened, taking center stage. But tonight, 2 Wants to Know's Ben Briscoe found out what happened to all of those concerns about vaping.
In Greensboro, Cone Health says vaping killed one of their patients in 2019. Dr. Murali Ramswamy treated that person.
This is really tragic, and so we are still understanding and trying to understand why patients are dying from vaping.
Since then, research around vaping has become less cloudy. We talked with 4 of the nation's leading health experts on vaping. All of them had the same message.
Yes, e-cigarettes are dangerous.
Vaping is definitely dangerous.
That e-cigarette can be negatively impact on cardiovascular system.
Are they dangerous?
Absolutely.
The first concern was vapes bought on the streets containing THC and nicotine.
Sometimes they're putting toxic chemicals into those vape pens.
But they've also seen problems with nicotine vapes bought over the counter.
There are metals in these cigarettes like nickel, lead, carcinogens like that while these kids' lungs and vital organs are still forming, you do not want to put that in your body.
And so there's a foreign substance in the lung, and they're trying to fight that. And so the body produces fluid and cells that flood the lungs. And basically the lungs fill with fluid and cells, and the patient feels like they're drowning. They get severely short of breath, their oxygen level goes down very low. Many times they have to be on a respirator.
It's happening more and more in a slow way. And so there are a significant amount of kids that are vaping an excessive amount of time. And right now we're maybe not seeing the long-term effect of this, but I think in the 30s and 40s, we're going to start seeing these young kids in clinic with some significant respiratory changes.
What can that do long-term to your body?
One of the biggest things is the permanent scarring that can occur in the lungs. So someone that could have healthy lungs their whole lives now could be on multiple inhalers.
Researchers have also found vaping can hurt your brain.
And as there's been studies now showing that this excessive nicotine in those developmental years of brain functioning can affect the way the synapses, the connections in our brains become more firmly in place.
And your heart.
The people who were using e-cigarette, they had earlier onset of stroke.
Earlier onset
of stroke, yeah.
Neel Patel's study found the average age of a stroke victim from smoking tobacco was 59. But in people who vape, it's 11 years earlier at 48. And the CDC says as of last year, more than 2,800 Americans have been hospitalized from vaping, and there were 68 confirmed deaths.
In general, it's not safe. It shouldn't be done.
During the pandemic, the FDA did authorize an e-cigarette to be sold for the first time. It was Vuse's Solo e-cigarette and its tobacco-flavored nicotine, made right here by R.J. Reynolds in Winston-Salem. The FDA said the company presented data showing the product helps smokers significantly reduce their exposure to harmful chemicals in traditional cigarettes. But the FDA stressed vapes are neither safe nor FDA approved, just authorized for sale. We tried to reach out to R.J. Reynolds multiple times for comment, but have not heard back.
Experts say they're even seeing middle school kids starting to vape. We shared some of their advice in our story on our website.